Yes, I am.
All right. So, on behalf of the Connecticut Department of Veteran Affairs, I'd like to welcome you to the 9:30 presentation from the Social Security Administration presented by Robert Rodriguez. I'd like to cover a few ground rules for the presentation. This session will be recorded. We will be muting all microphones at the start of the presentation. To ask any questions, please type them in the chat area and the moderator will review and pass them along to the presenter. If you are unable to utilize the chat feature, please use the raise your hand feature and you will be called upon. Both are located on the bar when you scroll over the meeting screen. Please do not share any personal identifiable information as these sessions are non-confidential. We suggest you keep your camera off as this will help to keep bandwidth down and improves connectivity. Thank you and enjoy the presentation.
Jeannie, thank you. Good morning, everyone. This is Rob Rodriguez. I'm a public affairs specialist with the Social Security Administration. I work out of the New Britain office, and just to kind of give everybody a heads up on the call, just across the board, to kind of give you like a little bit of an update, what's happening with Social Security. As of March of last year, because of the pandemic, all the field offices are actually closed for anybody to physically walk into the field office. So right now, the agency has an extremely big push to do things online. And additionally, we're doing a lot of service via telephone. For a service via telephone, we can call a person on a specific day and time. You know, we could call somebody Friday at 11. We can call someone, Monday at 9:30 in the morning. And we can conduct all the business over the telephone. And then your verbal yes, constitutes your wet signature, and then, you're all set. We have a variety of programs that are available to any and everybody. And what I want to do today is I want to kind of just give an overview of what Social Security has to offer, not only yourself, but also to any family member, anybody who works and pays into Social Security. We have a lot of programs. I think a lot of people sometimes only think that we're strictly just retirement, when in fact, that's not the case. People do become disabled. People do become eligible for Medicare. People do pass away, and there's, survivor benefits. And I'll talk about that. One of the pieces of information I want to also give you is that if somebody has a dire need situation, that maybe they're lacking food, or there's going to be some situation where there's a housing displacement or something like that. In some cases, the field offices can grant somebody an in-office appointment, but that depends upon what the management decides, and it depends upon what the scenario is. So normally, if someone contacts us and says, hey, I have a dire need situation, it's evaluated by the district manager, and then they decide whether or not they can set up an appointment. So that is an option that's on the side, if you will, that would kind of be of assistance if somebody happens to find themselves in that situation. So what I'm going to do is right now is I'm going to share a screen with you, and I'm going to talk about the programs that we have, that Social Security has. And I want to just see if I can get it up on the screen for you so that you can kind of take a look at it. And again, it's an overview, but it gives you a lot of key information, because I think a lot of people need to know about this. I'm always big on that. And if you can bear with me a quick second. Are you able to see this screen right here?
Yes, we are.
Okay, fantastic. Okay, so so to get the presentation started, anytime somebody has any questions or they want to get information about Social Security, don't listen to Cousin Eddie, don't listen to Cousin Joe. Your best bet is always to come straight to us, and our website at socialsecurity.gov is extremely helpful. It has everything from A to Z. It's very transparent, and this is where you're going to get any and all information relative to Social Security. Near the end of the slideshow, there's a picture of what the website looks like, And it's really important that you also, when you do visit us, that it's at socialsecurity.gov. There is another one that's called socialsecurity.com, has no relation to us. And some people do end up getting confused, and we've had scenarios where a person will pay for a Social Security card application when in fact all of our services are free. Okay, so you always want to kind of be aware of that, but always visit us at the website at socialsecurity.gov. So right now we do have almost 63 million people that are getting a benefit from Social Security. The biggest piece of the pie is retirement that you would notice in red. But like I mentioned earlier, not everybody makes it to 62 happy and healthy. There are people who become disabled. I've seen them in their 20s, 30s, 40s, 50s, early 60s become disabled, and that will be the next piece of the pie that you see right there in the light blue. I'm not going to say there's a benefit to getting disability benefits. To me, my thing is, if you have your health, you got everything. Okay, money doesn't really mean a hill of beans, but on the Social Security side of things, if you've worked in the past and let's say, all of a sudden you cannot work any longer and you're 48, you're 56, you're 60, and you can't work any longer and you apply to get disability benefits with us and you get approved, then the payment amount that you get from us is 100% of your benefit. It would be the same as you retiring at your full retirement age, where you end up getting 100% of your benefit. So you will see people in their 20s, 30s, 40s, 50s, early 60s that are getting a higher payment amount, because our assumption is if you hadn't stopped working here, this is where you potentially could have reached. And we take a look at the years that you worked and how much you paid into Social Security. We've been noticing because of COVID, there are these what they call the long haulers, the people who are suffering the after effects, and we recognize that with disability benefits, and that being the case, more people are kind of knocking at our door. I will tell you that it is a little difficult to get, and there's a couple slides on it a little bit later on, and I'll talk about the whole disability portion of this. And then in the next two slivers of the pie is the survivor benefits. Again, this is another platform that's available to all of us that you've worked and paid into Social Security. Every day, you probably read the obituaries or you watch the news and you hear on the radio, people passing away. So anytime a mother, a father, or a husband or a wife passes away, there's always a potential for benefits either as a widow, a widower, or children to get benefits as well. So this is a completely separate package from whatever the VA offers or whatever the state of Connecticut offers. And this is not only applicable to you, but it's also applicable to your family members as well. As long as you've worked and paid into it, that's where it's at. Just a little bit of backdrop. We have been around for the past 86 years. We just had a birthday like on August the 14th. It's been around 86 years already. You have been paying into these three insurances from the time that you were a teenager. If you ever looked at your pay stubs and you saw a little deduction that was called Rsdi, and that would stand for the Retirement Survivors and the Disability Insurance. And again, you've been paying into it in the interest that, okay, you are going to hit retirement, but what if something happens to you as well, and then you pass away? Or what if you become disabled? Again, this is an additional insurance that you've been paying into from the time that you started the program, from the time you started paying into it. We have the Medicare program, which is the health insurance. There's a couple parts to that. I'm going to talk about that. There's a couple of specific enrollment periods that you want to have some awareness about. And then additionally, we also have what's called the Supplemental Security Income Program, or what's known as the SSI program. This is a federal needs-based program for anybody who's age 65, blind or disabled at any age, but who has limited income and resources. So when I go out and give my presentations, I'm not always talking to, municipal or state employees or, people who work in big business. Across the board, everyone's situation is different. So there are people who have had health problems, have not been able to work. There are people who may have been incarcerated, people who've had, different work scenarios. And so this is potentially a program that can supplement for those people who may not have a strong work history if they can meet the requirements. Again, this is, I guess, part of the benefit of when you contact us is that, if you ask to apply for disability benefits, we ask you questions because now what we're trying to do is find any and all programs that you could possibly have some eligibility for. So, we do ask you questions if you have kids. We do ask you questions if you're married. We do ask you questions if you had an ex-husband or ex-wife, because you could always potentially have some eligibility there, okay? And the Medicare prescription drug coverage, I won't really talk too much about that, but again, this is something that's been in place since about 2003. I'm going to talk just a little bit about retirement. And if you could bear with me just one quick second, I just want to do one thing. Give me one quick second, please. Okay, so I'm back with you and I apologize. My son has some birds and they're just driving me crazy. I can hear the chirping going on and no bueno. But anyways, so this is just a little bit about just talking about, retirement. We do have a website that links into us. It's called mymoney.gov. It kind of helps you for planning purposes. Again, if you're married, you have a family member who may be around the corner to retiring, or they're thinking about it, or maybe if they're, 5-6 years out, now's a good time for them to start looking at what's going to be coming down the pike for them because they've been paying into Social Security. And, the program's not going anywhere. The politicians recognize that this is a political hot potato, if you will. So, again, this is kind of what's supposed to look like. You're supposed to use us as a base or a foundation along with any pensions, savings, investments, and other income. But the reality is that a lot of people who do get benefits from Social Security, a lot of times they're women. They may have not worked long enough in a company or something to get a pension because of maybe work history, staying home, taking care of children, so on and so forth. To me, the takeaway from this slide is if you're married or if you have your significant other, that you should be talking to each other because we look at your records individually. We don't put a cap on the fact that you're a married couple. And a lot of times, even a divorced spouse could potentially get benefits on a person's record, but it doesn't take any money away from, you individually. So the reality with this right here is when you take a look at this chart, this is kind of how it plays out for us. If there's any gentlemen on the call right now that, women outlast us, and it's always good to have the communication so that, later on there's no kind of surprises and, how much you're going to get. She knows how much she's going to get. And this way they can kind of just plan accordingly. So every year we normally have cost of living adjustments. And right now, anybody who's starting to get a benefit now in 2021 actually has a 1.3% cost of living adjustment tacked into the record. Right now, around October 13th, 14th, or 15th, or somewhere in that vicinity, right next month, we're supposed to get information as to whether or not there's going to be a cost of living adjustment for 2022. The word is just approximately that it could be maybe close to 5% or it could be upwards of 5%. I mean, that's hearsay. We don't know if that's going to be the actual case, but we will find out once October, around about the middle of the month, we're going to get that notification. And so everyone's going to find out what the cost of living adjustment will be for 2022. Okay. And to us, it's really important that a lot of people, you will get notified. It normally takes effect in the month of January. And for people, having a cost of living adjustment, even if it's a little bit's better than zero. Okay. I'm going to skip a couple of slides right here. I do want to mention that if someone is considering retiring, it's always good to contact us. We do have what's called an online retirement estimator. We do have a fact sheet that's called When to Start Receiving Retirement Benefits. And this is a really good primer because it's going to ask you a couple of simple questions and things that you should know. For example, that if you take your money early at 62, you're going to end up getting a haircut. Okay, you get like a buzz cut. But the longer that you wait, then the higher your payment amount's going to be. So everything depends upon when it is that you want to take and tap into it. Okay. We're going to look at your, what's your age and when do you want to take it? Those would be the kind of the two critical factors, but they're also going to ask you, okay, what's your health? What's your family longevity? And these are things to take into consideration, again, to educate you and have you up on board before you actually come and tap into your record. This is what the full retirement age picture looks like right now. Again, I'm covering the topic about retirement. Again, you can look at the year on the left and then find out what the full retirement age is. But as a caveat to you, there's no set rule and there's no expectation that you have to wait until your full retirement age. We work with whatever it is that you want to do. And if you want to get out at 62, because that's the earliest, or at 63, you can do that. There's nothing that obligates you to wait until your full retirement age. And probably about last year or a year and a half ago, one of our directors was at a meeting in Providence talking to maybe a group of about 250, 300 people. And somebody in the audience raised their hand and said, hey, what's the percentage of people who are taking their retirement before their full retirement age? And surprisingly, that number was around 72%. And and those are high numbers. Some people are probably saying, well, I don't want to wait. I don't want to wait to get higher benefit because I'm not sure how much longer I'm going to live. Some people have to tap into it for purposes because then they're not working, unemployment ran out. So again, this is that fallback. This little chart right here again is just a quick descriptive example of if you decide to take your benefits early. If you take a look at the very bottom of it where it says, let's make believe all of you on our call are 66 and that's your full retirement age. So if you tap into it at 66, then your benefit will be 1,000. But if you move over to the left and you take it at 62, you're going to notice that there's a reduction in there. Okay. And what happens is anytime that you tap into your retirement benefit before your full retirement age, that's going to be your benefit amount moving forward. Okay. You're not going to get, like a magical bump up, a birthday bump up when you hit your full retirement age. And that's been one of the questions that people will ask us all the time. The other thing to take note is, again, the longer you wait, then the higher your payment amount continues to creep up. If once you do hit your full retirement age, Okay, and you decide that, you don't want to tap into it just yet, or you want to wait a little bit, you end up getting what are called delayed retirement credits. This is an additional 8% per year that gets tacked onto your record. And you can get these delayed retirement credits all the way up until age 70. At age 70, the delayed retirement credits shut off. Okay, because at 70, we'll kind of start to pay you just automatically. But you do have the advantage of getting an extra percentage on the backside, and that could be beneficial to you. Move to a couple more slides up. Excuse me. So just a quick brief again, what we normally take a look at to determine your benefit for retirement purposes, we count the highest 35 years that you've worked. If you haven't worked 35 years, then we have to throw some zeros in the calculation, but it's not your last 5 or your high 3, just so you know that. And we calculate it differently than what a company would calculate it at. So bottom line with retirement, you have to work and earn credits. You have to pay the Social Security tax. You cannot have been out of work or not paying into it for the last 5 or 10 years and then, say, hey, you want to bring your record up to date by paying up to it. The law doesn't allow you to do that. But you do have to have at least a minimum of 10 years of work, those 40 credits, and you have to be at least 62 or older. Okay. And let me just skip 1 or 2 of these. As I mentioned a little bit earlier, when either a person, if you retire, if you get disability benefits from us, or if you get survivor benefits, we always look at whether or not there's going to be children who have eligibility or a spouse. And anytime there's a child who's under 18, that child can get a benefit on your record. We get older fathers all the time. Or if not, when somebody becomes disabled, if they have children under 18, those children qualify. If a person passes away, then these kids can get benefits as well. Excuse me, and I was thinking about 9/11. With 9/11 happening, just as an example, you had, some kids who were born that same day or within days after that happened. And so because the kids were under 18, and the parents had worked and paid into Social Security, these kids were now getting benefits up until age 18. So this is where that kind of that insurance concept pays off. Anytime there's a child who's not married, but who has a disability that started before age 22 could also possibly qualify as well. Okay, we call it a disabled adult child. We always ask you questions about a husband or a wife. And if you're a 62 or older, then that's going to come up on the radar. Okay, and then we're going to see whether or not he or she can get some benefits, and whether or not they can get some benefits on their own or also benefits on a person's record. And again, we always cross-check everyone's record. If you say to us you're married, we get both records, we take a look at it, and if you do any benefit as a spouse, we'll pay it to you. But everything depends upon the payment amounts, how much you've worked, how much you've paid in, and how much your other half has done the same thing. It doesn't reduce the payment to the worker. And then the final piece with retirement, but this is also applicable in other situations too. If you were married in the past and you had a marriage that lasted at least 10 years, your ex-spouse could possibly get some benefits on your record, but it doesn't take any money away from you. Okay, if let's say you're married 15 years, you got divorced and your ex married somebody else, but you didn't, you still have potential eligibility on that record. Okay, and if you remarry, now the door for you to get anything on your ex-husband or ex-wife's record is closed, and then we'll take a look at what the current marriage is. And then the last thing with just with retirement is, again, there's always a working piece that if you do get benefits from us for retirement purposes, you can still go back to work and you can still earn. We take a look at just wages or net income from self-employment. We don't take a look at any sort of outside income that you may have, and this includes whatever you may get from the VA. This doesn't come into play with us. The VA, on the other hand, may say, well, you're getting benefits from Social Security. They may or may not make an adjustment. But if you're under your full retirement age, right now this year, you could still make up to $18,960. In the year that you hit your full retirement age, you're allowed to make a greater amount of money. And right now it's at $50,520. And then the month you hit your full retirement age and above, you can make as much money as you want, and you can also get your monthly check. When I mentioned about the date in October with the cost of living adjustment, at that same time, they're also going to mention what are the new allowable work limits for 2022. I'm thinking maybe it might bump up to 19,000. It might bump up to 50,000, 600. But that information is going to come to everybody come October. Okay. If anybody happens to be married to a teacher, policeman, or fireman, you're going to want to look at this provision right here. It's called windfall elimination. And again, this is a specific offset that could have an impact, so you want to have some awareness about that. And then there's another offset as well that's called government pension offset that can have an impact on you or somebody else who either could possibly get benefits as a spouse or a widow, and that your other half or you are getting a government pension. There's going to be an offset. So one of the key takeaways from today's presentation that I want to kind of turn everyone's attention to is this right here. This is called the My Social Security account. The agency has a very big focus on this. Right now we've had somebody just mentioned the millions of people who have already created these accounts. This is the same thing as that your Social Security statement that you used to get. And right now you can go into our website at socialsecurity.gov. You can go specifically to this page right here to my account. And what you're going to do is you can sign in or you can create an account. This is going to let you get your record, and it's going to show the years that you worked, how much you paid into Social Security, your name, your date of birth, how much you would get for retirement, how much you would get for disability benefits, how much your survivors would get if something were to happen to you. And it's really important that you take a look at this, because what it does is it will give you, it will kind of give you your own personal information. You're going to want to take and double check it. If you've been working for, umpteenth years and all of a sudden you see that there's some earnings that are missing, you're going to want to take and question it. Okay. So this allows you the opportunity to do that. And what you have to do is you go to the website, you have to sign in or create an account. You got to provide us with some personal information to verify your identity. And we ask you tricky questions because we want to make sure we're talking to one and the same person so that nobody's, fraudulently creating an account for you. We've already had reports of ex-husbands and ex-wives that intimately know your information. And with that said, what they end up doing is they come to the website over here to kind of stick it to you, and they create these accounts. If you successfully answer the questions, okay, then you have to create a username and a password, and then now you have access. And it's really key that if you are getting benefits right now, or that you're contemplating it, then what happens is by setting up this My Account, if you don't get a benefit, you can request a replacement Social Security card. It's now available in Connecticut. If your information that the DMV has matches with what we have, then you can request a card. This is a newer service that we have. You want to look at your information, you want to review it, you want to double check it. And so again, you can print it, you can save it, and you can take a look at it. On the other side is if you are getting benefits from us, again, you can request a replacement card. You can take a look at your information. You can change your address and your phone number, your start or stop your direct deposit, get a replacement 1099 or even a replacement Medicare card. The advantage of creating this account gives you both sides of the fence. So you can look at your information and then you could also do things as well. I want to switch gears. I'm going to talk about survivor benefits, and then I'm going to talk about disability benefits, okay? And quickly with the survivor benefits, again, a mother, a father, a husband or wife passes away. Kids have eligibility, as you would notice right there. And then widow's benefits or widower's benefits can begin as early as age 60, but you'd end up getting a reduced amount, okay? So if you're in a scenario where you're eligible for retirement, but at the same time you're a widow or widower, you're now technically on two platforms. And we can give you a breakdown of, okay, this is how much you can get for retirement. Oh, and by the way, at the same time, this is what you're looking at for survivor benefits, because you can kind of switch and do either or. In other words, you can get retirement benefits, and then later on you can switch over to survivor benefits if it's higher. Or if not, you could do the reverse, okay, that you can get a reduced survivor benefit, leave yours alone, and then yours can grow and you can pick yours up at a later point in time. So, you know, we can kind of spell those things out for you. You have to let us know what it is that you know, the information. And, you know, it doesn't matter if you were married, you know, 10 or 15 years ago, or you were divorced 10 or 15 years ago, or you know, the person passed away 10 or 15 years ago. That information is still going to come up, okay? And there's a couple of other different bullet points and categories right there. I will tell you that with the survivor benefits, there's also a work stipulation where if you decide you are going to get survivor benefits, again, you're allowed to make up to the $18,960. But once you start to go over that, then, you know, you may or may not have eligibility, depending upon how much you're going to earn. So, okay. And, you know, when somebody does pass away, what does happen is that we do, the benefit amount bumps up into the 70% range. When someone's alive, it's normally in the 50% range, but when someone passes away, now it's bumping up into the 70s. And, you know, again, with individuals passing away every day, you know, here in the state of Connecticut, we've had like 8,400 plus people who've passed. Someone's going to come knocking at our door because there could be potentially some eligibility, either as a widow or widower. There's going to be benefit eligibility for a child or so. Okay. A little bit of a recap with spousal benefits. Again, as early as age 62, the full retirement age, and it's about 50%. When someone passes away, starts as early as 60 through full retirement age, and then the percentages bump up into the 70s. Okay. I really haven't seen this one too much about survivor benefits for parents, but we do ask the question because in some cases that is applicable. And then we also pay the lump sum payment, which is the mostly for spouses and some children. Okay. Now, two more topics to cover. So I want to talk about disability, and this is kind of the more critical one that I think a lot of people have to have some awareness about, you know, maybe with in vet situations, or it could be with family, or just everyone really generally across the board. For us, you have to be 100% disabled or you're not disabled at all. A lot of times vets and others may end up getting ratings of like 20%, 15%, 40%. That's all well and good on the VA side of things, but with Social Security, it has to be 100%. A person's disability is taken into consideration if they get a rating, but we have to take a look at medical records. And for us, your condition has to be something, it could be something physical, it could be something emotional, it could be a combination of the two. But it has to be something that's going to keep you out of work for at least 12 months or more, or that may result in the person's, you know, passing away. We look at your age, we look at your education, we look at your work experience. And I've had vets, you know, say to me in the past, well, you know, the VA gave me a 30% rating. You know, why do I have to, you know, present more information? Because of our regulations. I mean, it's taken into consideration, but it doesn't mean that person fully meets the requirements that, you know, Social Security has set forth. So we would ask you questions like, you know, what's your condition? When did it start? How does it keep you from working? We would need to know who are your doctors, hospitals, clinics, psychologists, psychiatrists that you've been to, addresses, phone numbers. You have to give us some dates. We would have to find out, okay, and ask you, are you taking medications? What kind of medications are you taking? What's it for? Additionally, we would ask you, what's your work history been in the last 15 years? Because we're going to want to find out what kind of work that you're doing. What's your work experience been? Have you been at one place for all these years? What do you normally do like in an 8-hour period? We're going to look at that as well. So it's difficult to get. And what normally happens as part of the process is that you have to have worked at least 5 out of the last 10 years. That's one of the first requirements. Younger workers, it's a lesser requirement. And I'm not sure if you've heard the rumor that, we automatically deny you the first time that you apply. That's not always true. Everything depends upon how strong your medical evidence is, what the reports are. And so when a person first applies, it normally takes between 60 to 90 days to make a decision, okay? If you end up getting denied, then what will happen is we'll send you a letter. You will have 60 days plus 5 days of mail time to file an appeal. Okay, and the first level of appeal is called a reconsideration. Okay, now what will happen is that information will go back up to a different examiner up in Hartford. If you end up getting denied at the reconsideration level, now your case goes before what's called an administrative law judge. And because of the volume of the administrative law judge cases with, pending disabilities, you could potentially wait up to 12 months or 13 months or even a little bit more before you do have a hearing. And, if you end up getting approved, then they go back and they look at, what was your disability date, and they take it from there. We do have something new that's not really relatively new, but there's something that's called compassionate allowance. And compassionate allowance is a listing of about 230 plus conditions that you may have never heard of. Okay, but if you happen to meet one of those conditions, then what happens is your case is done in about a week or so. And one of the ones that we've added recently, or not too long ago, was early onset Alzheimer's. So if you're diagnosed with early onset Alzheimer's, okay, your case is literally done within about a week or two. I've already have about 4 or 5 family friends in our circle, if you will, who've been impacted by this. And one of them was a bus driver in New York City, smart guy, married, 3 daughters, was always a hard worker. And then we noticed that, we knew there was a problem coming down the pike when he's asking people who are hopping on the bus which way to go. So his condition deteriorated, and unfortunately, today he's living in the Hartford area in a nursing home. And because he had worked and paid into Social Security, that money is helping to pay for his cost of care right now. So again, it's difficult to get. There's a lot of information that we take a look at. And if you are getting disability benefits, okay, you are allowed to go back to work. But the main thing is you have to let us know about that. Okay, so this is going to be something that's critical that, even if you are getting Social Security disability, again, there's a rumor that you can't go to work, and you can go to work. But the most important thing is that you have to notify us and you have to let us know about it. If you're getting regular Social Security disability benefits, we allow you what's called the trial work period, which means that you can go to work for a total of 9 months. The 9 months do not have to be consecutive, and you can make as much money as you want during those 9 months, okay? But after a 9-month period, what's going to happen is now we're going to have to evaluate what kind of work it is that you're doing, okay? And depends upon, how much you're earning, so on and so forth. Another thing that I want to bring your attention to is if you do get disability benefits from us, okay, every 3, 5, or 7 years, we have to do a review. Okay, so we're going to find out, is your condition the same? Has it gotten better or has it gotten worse? And so this is just to make sure that, things are current, what's your scenario? And then we're going to evaluate as to whether or not your benefits should continue. If while you do get your disability benefits and then you hit your full retirement age, once you hit your full retirement age, we no longer consider you to be a disabled person. You're now in the retirement zone, if you will. So you can still have your condition, but you're technically crossing over on paper. So now we classify you as a retired person. You can apply for disability benefits online. This is the fastest way. This is the best way. Right now, again, we're not allowing people to come into the field office. This gives you the option, and what happens is that once you submit this application, somebody from the field office, we all have internet claims taking units, and what they'll do is they'll take a look at the record and then they'll make a point of calling you back. And it's usually a lot faster because if you call us up and say, can I get an appointment? You may be looking at 2, 3, or 4 weeks, when by doing it this way, you can be online and somebody can call you back within about 3 or 4 days. Okay. This is the last thing I just want to talk about quickly, is just about Medicare. Again, these are the ways in which you can get Medicare. Normally, if it's your 65 or if you've been getting disability benefits for at least 24 months, you'll have Medicare. If you have ALS or Lou Gehrig's disease, or even if you have kidney failure or renal dialysis, this is going to qualify you for Medicare. And Medicare is a health insurance program that Social Security has. I know that a lot of VA personnel may have TRICARE for life, but usually if you have some Medicare eligibility, or if you're rounding the corner to getting 65, I think 8 to 9 times out of 10 certain that the VA is going to ask you to sign up for Medicare. Okay, and Jeannie or Martha, if you want to chime in afterwards, that's fine. Just to cross-check me. There's some specific enrollment periods that you want to have some awareness about. On our website, we have the specific link that talks about Medicare. But the one that you want to avoid in this scenario here is when it's on the left. That if you don't sign up when you're supposed to, then you would be limited as to when you can sign up. And this is in particular to Part B of Medicare. And then you can get a penalty for not signing up when you're supposed to. There's 4 parts. There's a Part A and a Part B. These would be the principal ones that you're going to run into. The Part A comes to you free. It covers hospital expenses. And then the Part B covers like doctor expenses. If you're getting a monthly check from us, we're going to pull out a premium out of your check. Right now it's $148.50. Okay. In the month of November, probably about the beginning or maybe mid-November, we're going to find out whether or not there's going to be a premium increase for 2022. So again, 2 months, 2 dates, 2 different entities that are give us some information about what's coming down the pike. Medicare C and D, we don't really get involved with that. But just as a heads up, the Medicare C, these are these outside insurances like Blue Cross, Blue Shield, Travelers, AARP, that offer all these plans to help cover what Medicare doesn't cover. Again, if you have TRICARE, you're probably a little bit outside of this, but this could be applicable to maybe a family member or so. Okay. I'm just going to jump ahead to a couple of different scenarios. Medicare.gov, our job is that once we sign you up for Medicare, our job is to take your money. Okay. And Medicare.gov will be the ones that would handle anything, after the fact. What's the cost, what it covers, what it doesn't cover. And this is their number right here that you can call, and that's their website. Medicare cards are now coming out in a new format, and they have been. It's kind of to avoid fraud. We used to put Social Security numbers on them. Now you have a specific number, and it tells you the effective dates of both the Part A and the Part B. It doesn't matter if your birthday is at the tail end of the month. It always begins at the very start of the month, if that makes sense. And then a couple last slides. We do have Facebook, we have Twitter, we have YouTube. We always tell a person to come onto our site, get information, contact us. Don't listen to Cousin Eddie or Uncle Joe, because we can always cross-check everything. The little red envelope on the left, if you decide that you want to, you can sign up with us and we can send you informational pieces saying, hey, the cost of living adjustments out. Hey, this is what the new Medicare rate's going to be. Hey, this is a new change. So we can send you alerts and you can sign up for that, and that's free. And then again, if you think someone's, committing fraud, you can call us up and they'll take your information and everything could be anonymous. We have found people who, do try to get over on the system, if you will. But again, those people who are doing that are disadvantaging people who truly do need it. And, when somebody does apply, we need information about your marriage, your divorce, your military service. Sometimes your DD-214s can give you some additional, possible credit. Okay. And we have a different online services. We have these retirement planners, a disability planner, and I think one of the key takeaways is that if you can create that My Social Security account, do that. The sooner you can do that, the better. It gives you, different options, it gives you your information. The website looks like this. It has specific blocks for like retirement, disability. There is one on Medicare. This is a little bit up. This is not really the newest version, but it kind of looks very similar. And again, it can give you, frequently asked questions, calculators, estimators, information. You can find out what office. We have it in different languages as well. So there's plenty for you. And again, you sign up for the services, and these are some of the things that you could do. And then lastly is, again, most everything is going to be done online. If not, you can call the toll-free number. And the reason they call it the 800 numbers because you got to dial like 800 times, but you will get through at some point in time. And the office is currently, an office visit is currently unavailable. Once the agency just says, hey, we're reopening, and then notification will be sent out to the public, obviously. And I think that really kind of covers everything right there. I know it's a lot of information. If you can bear with me 1 second here, I'm just going to come back up. Okay. And I know that's a lot of information. To me, it's really important that, just across the board, everybody has an idea as to what Social Security has to offer. If you're assisting somebody, refer them to the site, get information from us. I have been available, thanks, Ron, available to, act as not so much as a liaison, but I can be a connector, if you will, and at the same time as a resource. I've been with the agency long enough. If I can't answer your question, then what I end up doing is working in the New Britain office, I have 2 or 3 people that are extremely technical, and I'll reach out to them and say, hey, can you give me a second set of eyes on this so that I can get back to the person and, let him or her know, what the situation is and how we can help out. That's a constant. Again, on my end, I'm always willing to help out. And I think that's really a bit. Does anybody have any questions? I did say 6 hours at the beginning, right? So, I mean, I'm down 1 hour, but your call. Thanks, Ryan. Thank you. Bill, go ahead. I'm all ears.
You said we need to earn 4 credits per year in order for our wages or our salary to be counted. Is that correct?
Yes. In other words, the credits every year cost a certain dollar amount. Right now, it's about $14.95 per 1 credit. So if in this year you've already made more than $5,880, you have 4 credits tacked onto your record. So even if a person works part-time, working a little bit of part-time, and you go over at least 6,000 mark, you're going to get those 4 credits tacked onto your record. You have to have at least 40 overall. And then we take a look at all the years that you worked, and then we figure out, what the average is as to how much you can get. Does that help?
Yeah, that's good.
Thanks, Bill. If also whenever you may have contact with, other agencies, organizations, family or friends, if you want to have somebody from Social Security do a presentation, I'm always open for that. That's part of what I do with in the public affairs arena. I have counterparts that work in Waterbury and also in the southeastern Mass and Rhode Island area for our Boston region folks. Every region, we're broken down into 10 regions nationally. In the Boston region, we have a team of about 12, 13, 14 of us that normally, before COVID, we would go out and give presentations. We would visit places. I've been to the Rocky Hill facility. I've given presentations there before. Normally, we would be there in person. We would have a table set up for stand down. We would have information pamphlets. We would have computers and laptops set up, to assist people. That was always a great thing for us, and we always, relish the opportunity to go out and interact and take claims and help people out and answer questions. But right now, with what's going on, we're in a whole different world. We're in a whole different arena, and this is kind of what the method is right now, is just to do everything, virtual and contact free. Okay, I just wanted to see your question, Bill. Give me one quick second. Okay, if after initial retirement they go back to work, the monthly benefit may increase. Yes, that's a great question. So if you are getting benefits from us and then you decide to work, when the year finishes and you file your tax returns, okay, well, that information from the IRS comes to us, and then we recalculate your benefit. It's normally an automatic recomputation, if you will. We call it an arrow. It normally happens sometime maybe about midsummer. But if you want to kind of speed up the process and say, hey, I worked last year, I'm getting benefits, I want to find out whether or not I may potentially get an increase, you could provide your W-2 or your tax returns to us, come February or March, and then we could, put that in the hopper, and then it'll do the recalculation. Otherwise, it's usually automatic. It may or may not bump up your benefit, depends upon how much you're making, but if you're working, you're getting the benefit of getting the check, you're working, and then there's a possibility of an increase on top of having the cost of living adjustment as well. Okay. Bill, you have another question?
Yes. At what point do Social Security benefits become taxable in the state of Connecticut?
It's not so much in the state of Connecticut, but it's more so on the federal level. So if you file individually, the taxation piece comes into play when you could possibly have your Social Security benefits taxed either 50 or up to 85%, depending if you hit specific benchmark amounts. And I did have it up on a slide, and I kind of skipped that one, and I apologize. But you can find that on the website. I think if you're filing individually, it could be like between 34 to 44,000. It could be up to 50%. If you exceed 44,000, then now you're bumping up into the 85% range. One of the ways to minimize a tax bite is that you can request to have federal tax taken out of your check, but we don't deal with any sort of state taxes. So you can complete a form with us where you can have either 5, 10, 15, or like 22% taken out of your monthly Social Security check to help minimize that tax bite.
Thank you.
You're welcome. Thank you. I mean, there's a lot of information here. Again, we just so across the board, I was giving a presentation yesterday. I just felt like I was talking for like 10 hours, but there's a lot of information to take in. It's so across the board for, all the different benefits that we have. I was talking to state of Connecticut employees last week or the week before, and I'm just giving them an overview because I know a lot of people are going to be, when 2022 rolls around, there are a lot of state employees that there's a big contract change, and they're contemplating this. And some people are nervous about, the whole scenario of, okay, I'm stopping work, now I'm going to start to get a check. You will get a check from us lifetime, but it's always good that you plan, accordingly to see, what's up on your horizon. And the program is not going away. The politicians recognize that it's a political hot potato. Every time they talk about reform, everybody gets all up in arms, but then it just kind of comes to the back burner. And we recognize that changes do have to take place, but ultimately, Congress is always the final decider if there is going to be some kind of change, with Social Security. It's not from us. And, people will talk on the outside and they have a lot of different proposals, but, Congress is the ultimate and final decider if there's going to be some change. And the last time we had a big change was back in 1983. I think Ron has a question coming down the pike. Okay, so Ron says that the 2031 date, we just had what's called the Social Security Trustees report, and it's kind of like a report card as to how Social Security is doing, what the finances are. They do have a projected date of like 2031. It's just a guess. These are what the actuaries kind of saying. If Congress from here to the next couple of years makes a change, they're always looking to see whether or not they could push that further out. Because, we do have all these baby boomers coming in. People are being impacted by COVID. Survivor benefits are going up, people for disability. And it's always been a solid program. It's been there 86 years. There's, any question about it, quote unquote, going bankrupt, I don't think that's not going to happen. So, okay. But I do appreciate everybody's questions, though. Remember just to always, touch base with us at socialsecurity.gov. I'm available to answer any kind of questions. You can just reach out to one of the field offices, and always look up on our website. We have, just like our central office in Baltimore, and kudos to that entire team, is continuously updating and making the record, making the programs and making the website more user-friendly. It's got everything from A to Z, how we operate, our rules, where all the different field offices are located. We have things in different languages. We've got publications, we got forms. And, really, we're really kind of like the one-stop shop for any and everything that's Social Security, and we're super transparent and always willing to help. So I'm hoping that this is kind of beneficial for everybody who's on the call. And, if you could spread the word, all the better.
All right, well, if there's no further questions, I'd like to thank you, Rob, from the Social Security Administration. Great presentation, lots of great information. On behalf of the agency, thank you. Oh, we've got one more. Ron is typing in.
I don't know. You're welcome. Yes. It's nice to everybody in the call. I appreciate it, Jeannie and Martha, for getting the coordination. We always look forward to participating and stand down. If at some point in time we can come out, give a presentation or do it virtually, then I'm always extremely game for that. My calendar has been getting more and more individuals and requests to do presentations because this is what the method is going to be right now, just until hopefully this whole COVID situation passes.
Thank you.
Are we good?
We're good. This ends the session. Thank you very
All right.
much.
Take care. Have a great rest of the week and day.
You as well. Thank you.